Hello and welcome to our new communication format in form of short videos about Gabather. We decided to call the video Snapshot. This is the very first snapshot, end of April 2024. My name is Michael Robin Witt. I'm the CEO of Gabather, and what I want to address, whom I want to address in this particular videos, is the audience of a very interested, very loyal group of people that send me emails, SMSs, and phone calls. They're interested about what's going on in Gabather. Give us a little bit more context on what has happened. Give us a little bit of more context on what is going to happen in the future. This is how the audience I want to talk to in this particular video. I'm not going to give any financial breakthrough or financial lookout or prognosis at all. I'm going to be very conservative regarding names, dates, and numbers, but I'm going to give you a lot of background and context on the last press releases and information that we've had for the last couple of months. And if this format is of interest, we're going to expand it later on as we go along in the next couple of weeks and months. So I'm going to jump in right with both fees first. First press release, I got a number of questions about was a press regarding the provisional patent application that we did in, I think it came out 18th of March. So this is actually a patent application in a series of patents that we're building our IP portfolio on. This particular is a provisional application regarding the medical use of GT002. And it's just another layer on top of all the other layers, which are all related to the core of our patents, which is the composition of matter, i.e. the molecular structure of GT002, one family of compounds, and the second patent family that we also have. And on those, we have built up patents covering the synthesis of GT002, which is as important, almost in my opinion, as the composition of matter. And on top of that, we've put the formulation, very important patent for Gabather application. And the last one is a provisional patent, so you could call it a patent pending. And the whole idea with this is to put the foot in the door, so to speak. We have 12 months from the filing of this application to add more data. And we think that what we have actually discovered with GT002 is it is actually unexpected for an expert in the field. We think that's novel, and we think it's, of course, definitively useful. So, three main criteria for patents and interest in patents and getting them granted are actually fulfilled. So it is a new step or the next step in our patent portfolio development, and I think it's very good. It's in line with what we've done before, putting layer and layer on top of the IP. IP is very important with anybody that you talk in the partnering world. First question is always, how does your IP portfolio look like? And I think Gabather looks actually quite good. So that was the first patent press release, sorry, 18th of March. 10th of April, we came out with a press release, big one, of course, regarding the collaboration with the hospital in Glostrup, funded by the Innovation Fund Denmark, regarding the clinical trial of GT002 in patients suffering from schizophrenia. And I mean, I cannot, stress more how important this is. And, I think it really is a quantum leap for Gabather, and it reminds me very much of the quantum leap, and I will not forget that one, when we transited from being a preclinical to a clinical company, when it left the lab and started working with healthy volunteers. We've done 3 healthy volunteers study with GT002, and now we've moved from studying the safety and tolerability of GT002, and it's been brilliant so far. And now we go into patients, and it's again a quantum leap. Not a completely new ball game, but certainly we've begun a couple of divisions up. If you want to take a football analogy with this trial, it's a big trial, aiming at getting 20 plus patients, 30 plus healthy volunteers as controls. We'll be testing GT002 in an EEG environment, but also, of course, into classical language learning and memory tests of these patients after single dose. The trial is randomized, so we compared with a placebo and a control comparator compound. So it's a very big thing, and it's also, I think it's a very nice, basically a clap on the shoulder and a confirmation, and Gabather, that yes, that this is an interesting experimental medicine, and it's definitely the right way forward. And it's a very active, very interesting, and very good academic group we work together with. So we'll, of course, give a lot of exposure to Gabather in the future, and it will be very exciting. And of course, end of the day, it is also, fulfilling the promise or the aim that we've always had at Gabather, was we want to develop new therapeutic options for people with the suffering from neuropsychiatric neurodegenerative disorders. And this is certainly very exciting, almost a rocket launch for that. So it's absolutely brilliant. And I'm looking forward to this trial. And of course, hopefully I can keep everybody updated on what's happening there also, perhaps with this channel, probably. Third point I have on my list on the agenda is I get a number of questions always here, but what are you guys doing regarding funding, regarding third-party funding, and regarding soft money in general? And I just want to give some feedback and context in this. It's not always easy, and sometimes it's actually forbidden and impossible for us to publish that we have applied for a grant at a certain organization. They don't look too kindly on that. Of course, once you have it granted, then everybody's happy to be published, but not until you have actually got the positive feedback that you are granted in the bigger grants that we have. Until then, it is really rather low key, and preferably not to mention it. That is one reason from the granting organizations. The other one is that it's difficult to give concrete dates, because the decision is entirely in the hands of the granting decision, and that can be moved. So we cannot get a specific date. We're dependent on what we get to know. That's the second reason. And the third reason is, once you have a grant, a larger grant granted, then you always get into a situation where you sometimes have to negotiate the conditions of the grant and so on, and that is all has to be under confidentiality. So that is the reason why we have a rather low profile regarding what grants are around. But what I can say is that we are always, and that we've done from Gabather since day one, looking for grants in an academic environment, collaboration, grants together with other small companies, grants together with big companies. So this is an ongoing process, and there hasn't been a month where we don't have 1, 2, 3 grant applications pending somewhere, both at national, international level. So that is definitely will work ongoing. And again, the only thing I can guarantee you is that if we get a positive notice, you will be the first ones to know. So I think this was the 3 main answers to some of the questions that I've had. And then, of course, looking forward, the main focus will be, of course, now the clinical trial that we're doing in Denmark, the continuing with the other grants, perhaps for clinical, but also for preclinical work that we're doing, and of course focus in business development activities to look to find a partner or collaborator for GT002 or the other projects. We have a lot of things cooking always at the same time at Gabather, and once they come to fruition and we have success, then we're going to publish them. So I think that is all that I had in my agenda for this particular first snapshot. I hope to see you again in a second snapshot, not April, but maybe May, and coming up. I promise that I'll upgrade my little studio I've made in my office here for the next time. And if there are any questions or follow-up feedback, let me know, get in touch with me, and we'll build it up into the next snapshot. And until then, all the best, and speak to you then.